Of all things in short supply during the COVID-19 pandemic, one of the least likely may be one of the simplest, what looks like a regular cotton swab.
One of the important components is the swab that docs use to put up your nose to get the virus. No one would ever thought that that would be in short demand.
Not having an FDA-approved swab set back efforts by volunteers in Dr. David Harris's biorepository laboratory, who are now racing the clock to assemble coronavirus collection kits.
Some of the kits that we had made at the time were not usable. And so we had to spend some time in pulling out the old swabs and putting in new swabs and then sending the kits back out.
The kits themselves are simple: 2 swabs and a sealed vial with a transport medium inside a biohazard bag with instructions. Harris's team of 8 to 10 volunteer scientists can now churn out about 3,000 COVID-19 kits a week.
They know they don't have to be here to get their paycheck. They actually want to do something. I think they like seeing the fact that what they do now gets translated into helping people immediately.
Finished kits are sent to health facilities around the state.
Provided we get some more additional swabs in, then we're looking to do another 10,000 over the next couple of weeks.
Collection is the first step in fighting the disease, Harris says.
We're only testing those that are sick. So what do we find? We find sick people. We actually want to find all the people who are exposed and didn't get real sick, because they should provide some herd immunity to the people around them if there's enough of them out there.
In order to get a better hold of the virus prevalence rate, Harris says collection efforts have to be done on a much larger scale. That's where some flexibility from the Food and Drug Administration could help.
We're now trying to work closely with the FDA to say, we have these other ones that they never bothered to list them because this wasn't a problem. Would you accept them? It seems like they will.
While test kits are simple, their impact is vital, Harris says.
If you can't collect, you can't test. So it's such a simple thing that if you can't have a collection kit that somebody can use at a hospital or a drive-through, then you can't send it over for the really complicated molecular testing to tell you if you're infected.
Harris predicts the demand for kits will continue over the next month. In Washington, Kara Harris, Cronkite News.